We are here in the street of Toronto, Canada, and we have with us family doctor Francesco Anello, who's going to tell us a little bit about the importance of really take care of yourself. Doctor, tell us a little bit about how you feel about this whole situation here with the pandemic.
I feel that we should be putting more emphasis on strengthening our immune system. By strengthening our immune systems, we'll be able to handle the virus. We'd be able to have a much more mild illness. And one of the most important things about your immune system is that it requires vitamin D and it requires vitamin C. People who have sufficient optimal levels of vitamin D have either no symptoms from this virus or mild symptoms. The majority of people who seem to have either severe symptoms or who have died from the virus seem to have low vitamin D levels. So it seems to me that it would make a lot of sense to tell people to take more vitamin D. So for the northern latitude countries, that's usually somewhere around 4,000 to 5,000 IUs of vitamin D. Now down in the tropics, it may not be as important because most people get more sun. But then again, in the tropics, people tend to cover up and they don't get a lot of vitamin D. They don't get the vitamin D made from the sun. So it makes sense also during this pandemic to take some vitamin D. It's only pennies per dose, and it gives you protection, basically. And then vitamin C is very important also for the immune system. And with the start of any kind of infection, for the last 40 years in my medical practice, I have been recommending that people take vitamin C every few hours when they have an infection until they get over it. And that helps to reduce the symptoms.
Dr. Anello, how families are dealing or coping with these challenges nowadays?
Well, because of the lockdown, it's creating a lot of stress individually and also socially and within family units and such. And the lockdowns themselves really don't have a big effect on the progression of this pandemic. So I would say that we should be lifting the lockdown and we should be living life as normal as possible for our kids' sake, especially because our children are really suffering from depression. There's been an increase in Canada in child suicide, and our children are almost immune to this COVID. They get either a very mild disease or no disease whatsoever. They handle it very well. There should be no reason why children are locked down. They should be going to school, they should be playing, they should be children. And as families, as parents, as a father, as a grandfather, that's what I recommend. Let's let the children live free.
Dr. Anello, we sincerely thank you so much. Is there any country in particular that you can say that we can learn from them during this pandemic?
Well, you know, there was a situation in Peru actually, and they gave people ivermectin there, and the COVID incidence went way down. They got a new government in that stopped the ivermectin, and the level went way up. And I know in places like the Dominican Republic, they're using ivermectin as a treatment for COVID. Very effective. I think we can learn from that here in North America because they've almost outlawed the use of ivermectin for COVID, and yet it's very safe. Literally, it's dollars a pill as opposed to, say, remdesivir, which is being pushed by Big Pharma, $3,000 a dose. You do the math. Follow the money, and you'll be able to see why it is that the recommendations around COVID seem to counter what the science shows.
Do you think the government should stop people traveling to the Caribbean when I think, as you say, the sun, vitamin D and C is good for them?
No, in fact, we do medical relief work in Belize. We love Belize. We were there in February, and there was no problem. There was no problem traveling down. The problem was getting back. You've got the lockdowns, you've got the quarantine hotels, you've got these ridiculous interventions on the part of our government that makes it difficult for people to travel. There's no problem with traveling if you're careful with things and such. And going down to Belize was a pleasure.
Well, certainly, we'd like to thank you so much, Dr. Anello, a family doctor from Toronto, Canada. And we truly believe that mental health is affecting all of us in so many different ways. I do agree with you that we have to find a positive, healthy way that we can be free again and we can say, life is beautiful. Atrévete a soñar.
Exactly. Keep smiling. Keep laughing.